You've been lied to about cholesterol, heart attack, and stroke. Today, we're going to expose two real culprits behind the majority of stroke cases. And no, they're not the usual suspects like cholesterol or high blood pressure, at least not in the way we've been taught to think about them. To begin, let me tell you a true story. The grandmother of a friend of mine, she's 82 at the time, was told her cholesterol was dangerously high. So high, in fact, that doctors recommended a triple bypass surgery. She refused. She chose to live life on her own terms, stayed active, ate balanced meals, kept a peaceful mind. She never had the surgery. And she lived to be 100 years old. Sharp, healthy, and independent until her final days. Her cholesterol stayed just as high during the last 18 years of her life. This story isn't meant to reject modern medicine. It raises a deeper question. If high cholesterol isn't always a death sentence, then what is truly responsible for the strokes and sudden deaths we're seeing so often today? That question became even more urgent when I spoke to a rehabilitation specialist who works closely with stroke survivors. She said something that shook me. Many of my stroke patients are on cholesterol and blood pressure medication exactly as prescribed. They're fully compliant. But the stroke still happens. And the damage is just as devastating. They did everything right. And still, the tragedy came. So where is the real problem? These two very different stories force us to ask a hard question. Are we focusing on the wrong things? Are we being trained to fear a number on a lab report while overlooking deeper, silent forces that truly affect blood vessel function, brain circulation, and clot formation? In the next section, I'm going to reveal the two biggest culprits, clearly identified by science, yet still largely unknown to the public. And you'll see why addressing these factors matters far more than just lowering your cholesterol to an arbitrary safe number. We've been taught a simple equation: high cholesterol equals clogged arteries. That equation is wrong.
Cholesterol floating in your blood is not a plaque. Plaque is a physical lesion, a blockage that is formed inside the artery wall. Cholesterol doesn't just stick to a healthy artery wall on its own. For a plaque to form, two things must happen first. The lining of the artery must be damaged, and the cholesterol particles themselves must also be damaged or oxidized. This means you can have high cholesterol and perfectly clean arteries. And on the flip side, you can have normal cholesterol levels, but be at high risk if your artery walls are damaged and your cholesterol is the type that is easily damaged. This brings us to LDL, the so-called bad cholesterol. But even that is a huge oversimplification. LDL comes in two main types: a large, light, fluffy kind, and a small, dense, hard kind. The large, fluffy particles are mostly harmless. Think of them like big beach balls that bounce off a healthy artery wall. It's the small, dense particles that are the troublemakers. They are small enough to get into cracks in a damaged artery wall and start the plaque building process. The problem is, your standard blood test doesn't tell you which kind you have. It just gives you one total number. That's like knowing the total weight of traffic on a highway, but not knowing if it's made of bicycles or semi-trucks. The difference is critical. So, blaming cholesterol for strokes is missing the point. The problem isn't the cholesterol itself. It's the condition of your arteries and the type of cholesterol you have. When we only focus on treating a symptom like high cholesterol, we ignore the root cause, and that can be deadly. A report from PubMed noted that prescription drugs are the third leading cause of death, right after heart disease and cancer. The shocking part, half of those deaths occurred in people who took their medication exactly as prescribed. They did exactly what they were told. Why? Because most of these drugs are for lifestyle issues, high blood sugar, high blood pressure, things that are largely preventable. When someone says, "I have diabetes, but it's controlled with medication," the truth is nothing is actually controlled. The root cause is still there, and it's getting worse. That underlying imbalance, left unchecked, grows into heart disease and cancer. If you consider that treating only the symptom allows the root cause to create other deadly diseases, then prescription drugs become the real #1 cause of death. This is where we have to stop. Stop covering up symptoms and start facing the root causes. So what are those causes? What are the real enemies silently damaging your arteries every day? There are two of them. The first enemy is chronic inflammation. But what really causes it? First, let me explain. Chronic inflammation isn't the redness and pain you see with a sprained ankle. That's acute inflammation, a normal and helpful response from your body. Chronic inflammation is something else entirely. It's a low-level, damaging process that goes on for months or even years. This process directly attacks and weakens the inner lining of your blood vessels, called the endothelium. This lining is incredibly delicate, but it's vital for keeping your blood vessels smooth and healthy. When it's hit by chronic inflammation, the endothelium becomes rough, damaged, and cracked. This damage is the first step toward a stroke. It creates the exact environment where small, dense, and damaged cholesterol particles can get into the artery wall, starting the chain reaction that forms plaque. Let me be clear. The body sends cholesterol to these damaged sites as part of a repair mechanism. The problem isn't that cholesterol is present, it's why it has to be there in the first place. The root cause is that the artery wall is inflamed and damaged.
And the main reasons for this trace right back to our modern lifestyle and diet. A top cause is sugar and refined carbohydrates. Bread, pasta, cookies, and especially sugary drinks cause your insulin levels to be constantly high. Chronically high insulin is one of the most powerful drivers of inflammation known. Next are processed industrial vegetable oils like soybean, corn, and canola oil. Many of these oils have a very high ratio of inflammatory omega-6 fatty acids compared to anti-inflammatory omega-3s. This imbalance pushes the body into a constant state of inflammation. Also, long-term stress and chronic lack of sleep are major contributors. Both increase the hormone cortisol, which, when high for long periods, promotes inflammatory responses throughout the body. So, how do you know if you have chronic inflammation? Indirect signs can include joint pain, constant fatigue, or skin problems. But for concrete proof, there's a critical blood test you can ask for. It's called HSCRP. High sensitivity C-reactive protein. This test accurately measures the level of low-grade inflammation in your body, giving you a clear picture of your vascular health. You probably already know that high blood pressure causes strokes, but what causes high blood pressure? It's a condition called insulin resistance. When your body becomes resistant to insulin, your blood insulin levels stay high all the time. High insulin signals the kidneys to hold on to salt and water. More water in the blood means higher blood volume, which increases pressure on the artery walls. At the same time, high insulin also contributes to making the artery walls stiffer and less flexible. So high blood pressure isn't just a number to be lowered with a pill. It's a warning sign that your body's metabolism is in serious trouble. When you combine these two factors, an inflamed artery wall that is weak and constant high pressure wearing it down from the inside, you have created the perfect recipe for disaster. This is the direct mechanism that leads to a blood vessel getting blocked or bursting, causing a stroke, heart attack, and many other dangerous diseases.
So how do we stop them? The simplest way is to stop feeding them. This means sodas, cookies, breakfast cereals, white bread, and pasta need a hard second look. Every time you eat them, your body responds by releasing a flood of insulin. Constantly high insulin is one of the most powerful signals for inflammation. The second fuel source, and perhaps the most dangerous because it hides behind a healthy label, is industrial vegetable oils. Oils like soybean, corn, canola, and sunflower oil contain huge amounts of omega-6 fatty acids. Our bodies need a delicate balance of omega-6 and omega-3 to control inflammation. The modern diet has thrown this ratio completely off balance, pushing the body into a state of constant inflammation. Check the labels on your salad dressings, mayonnaise, and packaged foods. You'll be surprised how often they show up. I suggest you add 3 things to your diet. The first and most important is healthy fats. Natural fats are an essential building block for every cell membrane and play a key role in regulating your body's inflammatory response. Focus on sources like extra virgin olive oil, avocados, nuts, and especially fatty fish like salmon, mackerel, and sardines. These fish are rich in omega-3 fatty acids, a type of fat proven to have strong anti-inflammatory effects. The second is high-quality protein. Protein provides the necessary amino acids to repair and rebuild tissues all over your body, including the endothelium of your artery walls. Getting enough protein also helps preserve muscle mass, which is crucial for maintaining a healthy metabolism as we age. Choose clean protein sources like grass-fed meat, poultry, eggs, and fish. The third is low-starch vegetables. They're a primary source of antioxidants, vitamins, and minerals. These antioxidant compounds help protect your cells from oxidative damage, one of the key mechanisms that causes cell damage and promotes inflammation. Prioritize leafy greens like spinach and kale, along with broccoli, cauliflower, and bell peppers. These 3 components will help your body reduce inflammation, repair damage, and maintain healthy blood vessels. Your next step is to work with your doctor to ask for tests that give a more accurate picture of what's happening inside your body. The first and most important test is the HSCRP, or High Sensitivity C-reactive protein. This is a direct measure of low-grade chronic inflammation in your body. Second, get a deeper look at your metabolic health by asking for a fasting insulin test. Third, for cholesterol, ask for a more detailed analysis of your LDL particle size, often called an NMR lipoprofile test. This test will tell you if your LDL particles are mostly the large, fluffy, less harmful type, or the small, dense type that easily gets into a damaged artery wall. Your total LDL number matters less than the type of LDL particles you have. Continue watching our videos about the early warning signs of stroke and heart attack and how to prevent them on our channel.